This video is to be used with the Agency for Healthcare Research and Quality's SHARE approach, Essential Steps of Shared Decision-Making Workshop. To learn more about the training, visit www.ahrq.gov/shared decision-making. Patient Rebecca Adams has been experiencing urinary incontinence, and she is here to see her physician, Dr. Lawrence Miller. Her urinalysis is negative for a bladder infection, and the previous evaluation excluded other bladder problems. Rebecca is being seen today for urge incontinence.
Hello, Rebecca. How are you today?
Dr. Miller, I'm still having problems holding my urine until I get to the bathroom. I'm leaking before I can make it to the toilet, so I've been wearing these bulky pads. I have to wear them. My desk is at the other end of the office, far from the bathroom.
I see. Well, the last visit you said that you are not leaking urine when you cough, sneeze, exercise, or lift something. Has that changed?
No, I don't leak at those times. I'm just feeling this urgency to go and rushing off to the bathroom 10 or 12 times a day. It's a nuisance because I'm so busy at work these days.
Well, we've ruled out bladder infection and other bladder problems. It seems that you have a type of urinary incontinence called urge incontinence. It affects women across all age groups. Likely the muscles that you use to hold your urine are weak. Well, the good news is that there are treatments that work to help you to become continent.
Continent?
Continent, being able to hold your urine until you go to the bathroom. And even if you aren't continent 100% of the time, treatment can mean fewer times when you leak urine by accident.
That would be nice. How is this treated?
Well, there are quite a few non-surgical treatments for urge incontinence. Some lifestyle or non-drug treatments include bladder training or a medical device called percutaneous tibial nerve stimulation. Then there are medications.
There are a lot of choices. Could you go over the options?
Sure. With the bladder training, you hold your urine for longer and longer amounts of time.
I see.
With nerve stimulation, a thin needle is inserted near your ankle. Pulses of electricity stimulate the nerves in your leg that connect to the nerves that control your bladder muscles. And prescription medications can reduce your incontinence or eradicate it completely.
It's a lot of choices. I'm just not sure. What do you think I should do, doctor?
Rebecca, people with urge incontinence get results from all the treatments I just mentioned. But since you're busy at work and the bathroom is so far from your desk, for now, I'm going to prescribe a medication to help you with this problem.
A prescription? Well, I guess I could give that a try.
Now, I want to see you back here in about a month. Call me sooner if you're experiencing side effects from the medicines or finding that you want to do something else. I think we can get this thing worked out for you.
Now let's look at the SHARE approach, Essential Steps of Shared Decision-Making. The approach outlines 5 easy-to-follow steps to ensure you are effectively engaging your patients in their healthcare decision-making. Today, we will see there are 2 experts in the room, the healthcare provider and the patient. The provider, Dr. Lawrence Miller, knows about the evidence-based treatment options, the risks and benefits, and the effectiveness of each treatment. The patient, Rebecca Adams, knows her own values, preferences, and what's important to her lifestyle. They'll work together to reach an optimal treatment decision.
Okay, so we've gone over that your labs show that you don't have a bladder infection or other bladder problems. So tell me, are you still having trouble with leaking urine by accident?
Yes, and it's happening so often now. I'm wearing pads because my desk is so far from the bathroom. I get this really strong urge, and then I leak urine before I can reach the toilet.
Miss Adams, that has to be difficult.
It is.
Last time we discussed that you do not leak urine when you cough, sneeze, exercise, or lift something. Has anything changed there?
No, I don't leak at those times. I'm just feeling this pressure to go and rushing off to the bathroom 10 or 12 times a day, leaking along the way.
I see. This type of urinary incontinence, or UI, where you have this strong urge and then lose urine by accident, is called urge incontinence.
What causes it?
UI often results from problems with the muscles and nerves that help to hold or release urine from the bladder. The good news is that there are many treatments that don't require surgery.
Step 1. Seek your patient's participation. Invite your patient to participate in the process.
Let's consider the options before we decide on a treatment, because I'd like to come up with a decision together, one that's right for you and that fits your needs and your lifestyle.
Oh, that sounds good. I leafed through this booklet that the nurse gave me today, but I'm still a little confused about what the best treatment is for me.
Step 2. Help your patient explore and compare treatment options.
Okay, first let's go over 2 non-drug treatment options you might want to consider: bladder training and a medical device. Then we can talk about prescription medicines.
Okay. I'm kind of curious about that medical device. Can you tell me about it?
Sure. Percutaneous tibial nerve stimulation, or PTNS for short, is an in-office procedure. A thin needle is inserted near your ankle. Pulses of electricity stimulate the nerves in your leg that connect to the nerves that control your bladder muscles. About 3 out of every 10 women reported improved symptoms. The studies don't show how many women become completely continent, being able to hold urine without any leakage.
It's pretty interesting. I read about that one. Well, how long does it take each time, and how often do I have to have it done?
PTNS takes about 30 minutes each session. Every patient is different, but we'd start you out once a week for the first 6 to 12 weeks.
30 minutes each week? And it has to be done in the office, right?
It does. Let's go over a treatment you can do at home called bladder training or timed voiding. That's where you build up your ability to hold your urine for longer and longer periods by following a schedule. The goal is to have you go only once every 3 or 4 hours. About 4 out of 10 women reported improved symptoms with this treatment.
4 out of 10 women got some relief? That sounds pretty appealing to me, and I can do it on my own.
Okay, so we've talked about PTNS, the nerve stimulation, and bladder training. What other questions do you have for me at this time?
I'm good. No questions right now.
Okay. Prescription medicine in pill form is another treatment option. About 1 to 2 women out of every 10 have improved symptoms or no urine leakage.
Can you tell me about the side effects to the pills?
About 1 to 2 out of 10 women had dry mouth, constipation, or dry eyes. Some women experienced more serious side effects, such as rapid, irregular heart rate, but that's very rare.
Step 3. Assess your patient's values and preferences.
So, we've gone over the drug and non-drug options. Bladder urgency and leakage seem to be making your workdays and everyday life difficult. Which of these treatments sound like they would be the best thing for you?
I might have a hard time getting off work for that nerve stimulation. The bladder training sounds like something I might be able to do.
Step 4. Reach a decision with your patient and arrange for follow-up.
Are you ready to make a decision on a treatment option now, or do you want more time to think about it?
I'm leaning toward doing the bladder training. I can do it on my own, and I don't have to come into the office and take time off from work. And I don't have to worry about the possible side effects of medicine.
Bladder training sounds like a plan that fits into your schedule. Is that something you'd like to get started on?
Yeah, I'd like to give it a try.
Great. The nurse can see you today if you'd like. She can help you set up a schedule to follow for bladder training. And she also has an online video you can watch.
Oh, that sounds good to me.
Step 5. Evaluate your patient's decision.
Come and see me in 4 weeks and we can evaluate how bladder training is going. At that time, we can decide if we want to add another treatment. Call me sooner if you have any questions.
Okay, I will, Doctor. Thank you so much.
We wish you much success in incorporating the SHARE approach with your patients so that treatment decisions are shared. This video depicts a fictional example of shared decision-making and should not be interpreted as a treatment recommendation. Patients should work together with their healthcare team to make treatment decisions that are right for them, based on available evidence and individual needs and preferences. To learn more about the training, visit www.ahrq.gov/shared decision making.